Can anyone confirm?
Only Mother Philomena.
Okay.
Which is for food and drugs as well.
Okay. Madam Philomena, if you can hear me, can you check with your director so that you can join
Okay,
online?
I will.
We need that to be online so that we can start.
Okay, sir.
Thank you.
Thank you.
Good morning, very able and distinguished Permanent Secretary, Federal Ministry of Health and Social Welfare, our directors, heads of agencies, ladies and gentlemen. And I also special greetings to our keynote speaker, Dr. Chukwumezie Okolo. Today's webinar is one in the series that we started almost a year ago. And very importantly, we will be taking a topic that is of public health importance at this time: water safety best practices, especially for water handlers and communities. You wonder, why are we talking about this? But it's so important as civil servants, public servants, and also professionals that are saddled with the responsibility of monitoring, evaluating some of the programs and activities that happen in our various departments in the health sector, for us to be equipped with the right information that we use on a daily basis to provide this. I want to especially appreciate the Department of Food and Drug Service, ably led by Mrs. Adeola Olufowobi Yusuf, MNI, who graciously accepted that the department will take up this particular webinar at this time. I also want to remind all of us, especially those of us that are civil servants, that today is a dedicated day for our performance management system, PMS. So you see my cap showing PMS champion. Today we dress like this to create awareness about our performance management system, which is one of the pillars of our Federal Civil Service strategic implementation plan, 2021 to 2025, which is still being implemented by the current administration to promote performance management. So today, our webinar is being co-hosted by the Department of Food and Drug Service, and we have this important topic on water safety, best practices and preventive measures for water handlers and communities, that we will listen to a very an erudite scholar and practitioner, Dr. Chukwumezie Okolo. So before we call on him, mine is to welcome all of you and to also especially appreciate our Permanent Secretary for creating time to be part of this webinar today. And all other Permanent Secretaries and people from other ministries that have joined, I welcome you to this webinar, one in the series that the Ministry of Health and Social Welfare has instituted almost a year ago. And we are glad that our sister department, Department of Food and Drug Service, is taking up this co-hosting at this time. So welcome you all. I'll now invite the head of Department of Food and Drug Service, Mrs. Adeola Olufowobi Yusuf, MNI, to give our opening remark. Madam, you can go ahead. Okay. Thank you. You can start speaking now.
Good morning, everyone.
Thank you.
Good morning. Good morning, my Permanent Secretary and all other permanent secretaries that have taken out time to join us this morning. I want to say welcome and thank you for being part of this program. We are glad to have everyone this morning because of this important topic. We are looking at the water safety, best practices and preventive measures for water handlers and communities. We all know if our water is not safe, it can be contaminated, which can lead to some waterborne diseases such as cholera, diarrhea, typhoid, and all other related waterborne diseases. I want to say thank you for the platform given to pass out information. Like when I came back from leave last year, I told my staff that because we don't have allocation doesn't mean we can't pass out information. So we wrote a memo to our transformative permanent secretary that we want to start webinar. Then in our response, we're told that we go back to planning department that there is already an existing platform. Gladly, we started the journey. We had one last year. When I was about to assist the unit to go to head the department, I told them that, look, we have to continue passing out information. So we met again, we decided on this noble topic. And today we are here today. And I want to appreciate Dr. Okolo for having time and interest in the department and the ministry as a whole. Just last week, Dr. Okolo was in my department giving us a lecture on leadership and policy development, which was quite interactive and informative. So this morning we have him in our midst again this morning to do justice to what he knows how to do best. I want to say thank you for having us in mind. I want to say thank you for giving your best into the country. Water safety is everybody's business. When we have good water, we have less money to spend on such ailments. So please let us listen and let us go back and tell our people that water safety is everybody's business. And when we have good water, quality water, we are sure of good health. Thank you, and let's have a wonderful interaction. Thank you for the audio. Over.
All right, thank you, Dr. Adeola from Department of Food and Drugs. So before the keynote speaker come on board, I will be reading the biography of the keynote speaker. Please kindly mute your mic. Okay, Dr. Chukwumezie Okolo is a Nigerian-American Registered Pharmacist, public health epidemiologist, clinical scientist, and leadership specialist with over 25 years of experience in health system governance, policy, and workforce. Development across Nigeria, UK, and the USA. In his current role as Executive Director of Rite Place Center for Leadership and Strategy and Rite Place Health Initiative, he has delivered numerous high-level speeches, seminars, and workshops for government agencies, academics, and health professionals on public health leadership, critical appraisals, system strengthening, and water quality governance. His work focuses on advancing evidence-informed decision-making, institutional performance, and sustainable public health transformation. Dr. Okolo had a beautiful career both in the UK and USA for about 2 decades, most of which was spent at Walmart Pharmacies and Rite Quality Pharmacies in Texas, while doubling as a clinical scientist. A serial award-winning author, a poet, and a scholar practitioner, he was finalist at USA Best Book Awards 2013. He's also the author of As Men of Honor, a clarion call to leadership, a book that tries to set the roadmap for pharmacy practice in Africa. Dr. Okolo is a certified human rights consultant with the USIDHR, a fellow of the African Institute of Public Health, and a member of National Technical Working Committee on the enforcement of the national standards for drinking water quality, among others. Dr. Okolo was a doctoral fellow in public health at Brunel University, West London, where he specialized in social determinants of health and subsequently gained a reputation as a consultant. He has reviewed for several high-impact journals, especially the Journal of Healthcare for the Poor and Underserved, based at Johns Hopkins University, USA. Currently, he also serves as a senior lecturer and head of clinical and administrative pharmacy at the European University of Nigeria, Abuja. He also collaborates with other universities in Nigeria, UK, and USA on areas of interest, especially primary healthcare revitalization. Also, Dr. Okolo holds PhD in leadership studies, that's in Johnson University, TN USA, MBA in international health management, Kile University, UK, MSc Public Health Epidemiology, University of Ibadan, Nigeria, BPharm Pharmacy, University of Nigeria, Nsukka. So on this note, I will call on the keynote speaker, Dr. Okolo, to come up for his presentation. Thank you. Please confirm if you can hear me, and if you can hear me, please, Dr. Okolo, unmute. Go on with your presentation. Thank you. Hello, can anyone hear me from the panelists? Okay, thank you. Let's run through the ground rules before Dr. Okolo come on with his presentation. So the general guidelines here, we should use the chat feature for general comments and questions. Then in terms of engagement and interaction, use the raise hand feature if you would like to speak. Questions for speakers should be posted in the Q&A section. Then stay respectful and professional in all interaction. Then for the technical and then accessibility, if you are experiencing any technical issues, please refresh your Zoom application or reconnect. The session is being recorded. If you prefer to remain anonymous, turn off your video and update your display name. Then for closing and follow-up, a feedback form will be shared at the end of this webinar, and then additional resources and contact details will be provided. That's post-webinar. Then follow the webinar organizers on social media for updates. Thank you. Please, Dr. Okolo. Over to you, please. Oh, okay, that's fine.
Can you hear me? Can you hear me now?
Yes, we can. Yes, we can
awesome.
Hear you.
Yes, I apologize a million times for this. Nothing but technical issues we are having here this morning. But I'm glad that at least now you can hear me. So I was gonna say thank you, Mr. Moderator, for introducing me, and thank you all the directors here. I sincerely apologize for these technical issues. I also had mention made about the PAM secretary. Please, I celebrate you for being here. Everybody else, please. We don't have a lot of, we have already lost a lot of time, so I'm going to go right away into the discussion. I'm sure we're going to have some time at the end of the day to now catch up on the missed time. So please bear with me and forgive us for these issues. Now, this morning we're talking about water safety best practices and preventive measures. And Mr. Moderator, are you going to be displaying the slide for me? Hello?
Yes, yes.
Okay.
Yeah.
All right. So is that my first slide?
Yes, please confirm if you can see it. Yes, sir.
Open it. Yeah, okay. I wanted to see the one before this one. Go back up the one before this. Okay, next slide. Next slide, sir. I can't see the next slide, sir.
Confirm if you can see this slide now.
Okay, I can see it now.
Okay.
All right. So in this meeting today, we're going to run through quite a few very salient points. And like I said, I will go through it, and then we'll have at least some time to interact. So that way, if there's anything that we missed in the process, then we'll catch up on that. The director had already said something that was very important in this meeting, the fact that when we give people clean water, then we can be sure that a lot of diseases, a lot of infirmities, a lot of those kind of issues are not going to be something to worry about. It means we're going to decongest the primary health care centers, means we're going to have less time lost by people who are sick to either to school or to work and those kind of things. Can you still hear me? Can you still hear me?
Yes.
Yeah, for some reason I think my side is disconnecting and connecting. Okay, so if you can hear me, I will just go ahead and go through. I'm not seeing his slide, but I can talk from mine. Okay.
So sorry, maybe I should drop the slide and then share it again so that you can see. It could be your network.
Okay, so maybe let me go through it. Maybe at the end of the day, you can share the slide with anybody else. But on my side, I think the slide was getting in my way. If everybody can hear me, I can go on like this.
Okay, go on.
Okay. So we are saying that the water safety is everybody's business. Maybe that would be the place to start. It's everybody's business for the reasons already given and more that we're going to give. So it is not just one of those academic exercises or one of those things that we use to fill the gap anymore. Water safety is a core public health protection function. Because again, every cup of unsafe water has the capacity and capability of causing disease, and what we want to do is to prevent. And so when we emphasize water safety, we are paying attention to all those preventive actions that could stop diseases from happening even earlier on before they get anywhere along the chain of transmission, a chain of contamination, a chain of multiplication. So today, please, can I encourage us to imbibe some form of opinion that all of us are leaders in ensuring water quality and water safety in our houses, in our communities, in the workplace. Why is this conversation important? Because again, waterborne diseases do not always announce before they show up. And you don't know the cup of water that has the disease that could bring a whole family down. And of course, we know that contamination is not even something that we can always see with the eye. So oftentimes they're invisible, and the signs may even be a little remote. So you may not be able to attribute, and then of course, sometimes also they accumulate. And when they accumulate, those effects accumulate from each cup or from one cup or one drop. And then by the time they now it begins to manifest, it could have a lot of health, economic, and other unwanted results. Now, across Africa, not just Nigeria, it has been claimed that a good percentage, some say 70, some say 75, some say 80 of the diseases that are prevalent around here are somehow waterborne, water-associated, water-related. And that means there's something in our water that shouldn't be in the water that is causing a problem. And some of these have even been attributed to diseases like cancer. Now, even though we all know typhoid, we all know cholera, we all know those, but there are other diseases that ordinarily you won't even be able to attribute. A cardiologist told us that they have even found out that a lot of the cardiovascular issues are also waterborne or water-related or water-associated. You don't even see all of those in the regular literature. And so that is why this conversation is important, because water is life. And water touches every aspect of our lives, and every one of us somehow depends on water. So water quality, investment in water safety will be a very beautiful investment for national development, for economic advancement, and for human capital development. And so this conversation today is important because it takes us to the place of awareness. It forces us to begin to pay attention and to begin to see what we can do as partners with the health ministry and as partners with our communities to ensure access to clean quality water. The aims of this webinar, it is our expectation that this will add to the effort to strengthen our preventive capacity in focusing on risk awareness, and also in highlighting the need for best practices. And all of that is about preventive measures across water supply chain. Again, if you don't take anything away from this call, at least take away from the fact that we are saying that the emphasis is on preventive measures. What can we do to prevent water and water-related, water-associated diseases from happening, a priori? So we are not just trying to share information. We are not just trying to tell you what you already know. But the part of the idea of this conversation is to reinforce in us systems mindset. A systems mindset requires that we look at issues holistically, not just linearly. Because when we understand how our actions or our inactions contribute to health outcomes, especially unwanted health outcomes, then it will now require us to change some attitude or to change some behavior. Or it will also now help us to be able to communicate to those who don't know, so that we can see as a critical mass of us begin to do the right things, then we can begin to change the trajectory that we see. So by the end of this section, we hope that participants should have a proper understanding of the public health importance of water safety, which is also expected that we will have a very understanding of the critical risk points along the supply chain, and to be able to apply best practices as water handlers. Because when we define water handlers, we find out that in some ways, all of us are actually water handlers. And we also hope that to be able to help add to the conversations around regulations, strengthening, and strategic communications within the health space, and especially within water quality and water safety. Now, the first session of this presentation is going to look at water safety as a public health imperative. Number one point there is that most waterborne diseases are preventable. Most of them are preventable, and that is good news. From cholera to typhoid, from hepatitis A or E to diarrhea, these are not inevitable events. And so this conversation is important so that we can leverage that opportunity. Because what they do is, when we begin to have a lot of cases like this, they signal failures somewhere along the chain, failure somewhere along the public health, preventive public health infrastructure. Now, oftentimes we within the healthcare space, we pride ourselves in how quickly we're able to respond. We call it emergency responsiveness, or whatever beautiful names we call it. How about we pride in ourselves in diseases that were prevented, in outbreaks that never happened, in waterborne disease that didn't even come because somebody did the right thing the first time. So if we do the right thing the first time, and everybody does the right thing the first time, then we shouldn't even be talking about how quickly we respond to outbreaks. We should be talking about 10 years of waterborne disease-free environment. That would be a good thing. So that takes me to systems impact of unsafe water. Now, when water safety fails, the author has alluded earlier, that it means hospitals will be overcrowded. It means that our families are going to lose time that they could have used for other productivity, economic productivity. It means that some children will miss school. It means that some communities will even begin to question the health system, or now doubt the public institutions. And then questions will be like, okay, so what are these people doing? So what is this person doing? It will now begin to undermine the regulator's credibility, just because, and these things can, and then these things are things that are already avoidable, like we already said. So water safety protects not just the health, but the economic stability, and very importantly, the social trust that we need to have as civil servants, as ministry, as regulators. Now, part of our expectation from this meeting is that we all understand that water safety is a central responsibility of public health system, and public health system will begin with the Ministry of Health. And so it will be a beautiful investment if government knows how much that Ministry of Health can save them from diseases. So to also pay attention to this. Now, so the public health system, now when you look at it holistically and through systems thinking, now goes beyond Ministry of Health. It involves Ministry of Water Resources, it involves Ministry of Education, it involves your innovations, your agriculture. So you find out that water quality or water safety affects every facet of our ministries, of our businesses, of our endeavors. And this is why we expect that everybody should take water and water treatment, water handling, water practices very seriously. Now, there are some critical points that are very important for us to note in the water supply chain. Because what happens is that water travels through multiple stages before it gets to consumption. We are familiar with some of the sources of water, some treatment that happen with water, the distribution channels, the storage, and then of course the handling. Now, along this chain, contamination can happen and can occur at any point. And again, if it happens at every chain, that means at every point along the chain, that means it accumulates. So this is the major reason why this conversation must be looked at from holistically from a systems perspective. Because the risk at source could be small, could be minimal, but then it could grow over time as you travel down the chain. So let's say, for example, at source, one colony of some coliform, contaminates the water. By the time it gets to the consumer, it's properly multiplied. And so it's also possible at some point that water could be very good and clean at source, but as it travels down the line, some people have opened their taps and they saw black water coming out of their tap. Meanwhile, this is probably tap water that came from the same water source that everybody else is fetching and drinking. So that means somewhere along that chain, something happened to that water and changed it into something that they cannot take. And so understanding these the supply chain is key, and making sure that everybody that is a player or a partner, a stakeholder within that chain understands the level of responsibility. I give an example. Somebody who is packaging sachet water, but he has no idea about basic microbiology. Does not understand why he needs to wash his hand, or why he needs to wear some gloves or cover his hair or whatever, where he is packaging and bottling water. Now you can see how much of a public health hazard such a person can be. Because for him, he's looking at how much money he make from his sachet water. But he can become a hot spot for cholera, a hot spot for typhoid, right there for a whole community, for thousands of people. And this kind of conversation is important for us to be able to bring those kind of issues to the fore, so that everybody will be on the same page. Now, a lot of risks are the source I have already mentioned, and we need to pay attention to those. Let's say again, for example, somebody who is supplying water to a neighborhood, but this water is coming from a borehole, and this borehole is probably next to a sewage line. I have been to a few water sources and asked some questions, and people don't have a clue the distance that they should observe between their water source and their sewage line. In fact, one of my friends was building, and I went there, and I asked him, I said, "How far is that not your sewage line?" He said, "Yes." "Is that not your water?" I said, "Can we check?" It was 19 feet. 19 feet between sewage line and his water source. And we see a lot of those kind of things happen around town. And so right here, we can as well start predicting the odds, even before he moves into his house. And me and him had some long conversations around those issues. So protecting the source is often one of our most cost-effective preventive strategies. Remember that this is about prevention. Our emphasis today is going to be more about prevention rather than cure. Now, on the treatment side of things, of water also, sometimes we have a lot of inconsistencies. in one of our engagements with water producers, we asked some of them when was the last time they changed the filter for their aqua system. By a show of hands, only a few hands were up. Some of them don't remember. In fact, when we even further engage them, some of them wash and reuse their filters that the manufacturer said cannot be reused. And then you ask them, they say it's expensive. In fact, some of them don't even drink the water that they package and sell. As it is that bad. And so we're talking about inconsistent treatment, inconsistent filtration, inconsistent poor filtration. Can you hear me? Is somebody, can you hear me?
Yes, please.
Yes, please.
Okay. So you're talking about, so we can see how safety can be compromised at any of these stages. Now, how about if these people have the knowledge and the know-how, the support, whatever they need to make sure that treatment is consistent, filtration is as prescribed, audit is happening, there is documentation, not occasional, then we can now start guaranteeing some quality. And when we start documenting and guaranteeing some quality at source, the hospitals will start looking for, we will not even be talking about antimicrobial resistance like we are talking about it, like it has become an epidemic. So all these things kind of are connected one way or the other. And it's really painful to watch these things happen when they could actually be prevented. Now there is also the risk. Again, we are looking at the chains. The risk when they are distributing the water. Sometimes you see some of these Meroa people that they're carrying water, and you could actually look inside that water and see something dancing inside there. We used to think that microorganisms. Now we see macroorganisms dancing in water that Meroa is going to supply some people. And you'll be shocked that some of those water people are using them to cook, to drink. But they even supply some of my health centers. You can't believe it. And so those Meroa people that are carrying, who certified them? Who follows them? Who regulates them? Who monitors? Who makes sure that they wash their bucket, their jerry cans, or whatever they use to supply the people? The tankers that supply water. How do we even make sure? Who check that the source of the water that they are fetching to supply is good? In some place they said the herdsmen had killed somebody and dumped him somewhere along this river line, and these tankers were downstream fetching water to supply. Is that crazy? So unclean tankers, broken pipelines, a lot of cross contaminations along and during transportation can actually undermine efforts, safety efforts that we make around water safety. So we must pay attention to such things. Now, safe water at source does not also guarantee safety at the point of use. Like I already said, when that water is distributed, we have taken time ourselves. We had a few complaints about water supply in the metropolis, and we went and spent a whole day with Usmada to look at what they do on a day to day, from department to department, session to session. We spend time, we ask them questions, we watch them do what they do, and so we're trying to connect the dots. Now you realize that it is not difficult to know that if the pipelines have been 50 years old and half of them are already rusted, that chances are that the water that they're going to get will not be what they supplied you, assuming everything was done right at first. And so that is very important for us to pay attention to. Now, let's talk about the storage, the risk of storage. Even in our homes, I remember when we were small, we used to store water in some pot, and everybody would go and dip the cup in that pot. to fetch water and drink from that cup again and keep it on that table. And we do this all day long. So now when I think about it, I say, whoa, I don't know how we're surviving those days, distributing. Now, so you see that in the storage, in some of our storage tanks, even I have questioned some places that you come, you see like the bottled water, they are left out under the sun for weeks and weeks. And I was asking someone, I said, has anybody looked into this to find out by the time this water has been sitting out in plastic, under the plastic for 1 month or 2 weeks, what are people actually drinking at the end of the day? By the time we're able to quantify microplastics, I'm sure we're going to have another level of challenge, another level of problem to deal with. But suffice it today to say that our open tanks, some of those our dry containers, and all the exposure to the environment can be opportunities for contamination of the water sources. And so self-storage is just as important as treatment and as important as guaranteeing the quality of the water at source. I went to a water packaging company somewhere out of the FCT. And I was asking a few questions. And this guy, I asked him, how do you guarantee the quality of the water that you supply? He said, we check the pH. You check the pH, and that's what you do. And the major supply. Now, I said, where do you get the source of your water? He said, we get from different sources. I said, how do you guarantee that the quality of the different sources? He said, we just check the pH at the end of it. So at that turn, we can see how that water, even though it looks clean in their eyes, could be a problem both at storage and at handling. So let me summarize that section by saying that poor storage, poor handling, poor treatment, along that chain of distribution, poor hygiene, hand contact with water, all of that can actually introduce pathogens, can introduce death, can introduce all kinds of disease causing germs. So part of our effort with this process will be to communicate behavior change and the proper behavior to the last mile, from source to destination. Now, and that takes me to the types of contamination that we see. We are familiar with biological, but sometimes we're also familiar with chemical, but a lot of times we don't really just know how much of a problem those can be. In our last conference, a lady came from Borno State to talk about the chronic kidney disease of non-etiology happening in Yobe State. How much of that is in the water was interesting for us to see at the conference. Meanwhile, we know that as we speak now, people are dying in Yobe State of chronic kidney disease. We call it unknown etiology. But I don't know why we still accept this unknown etiology. Rite Place, we said most of it is in the water. If they give them good water, we can start from there. So when we're in doubt, in a thing like that, let's give the water. And I'm sure that we heard that the governor is doing something already about it. So hopefully we should be able to connect again at some point and see how much they have been able to reduce the burden of chronic kidney disease just by investment in water. Now, so when we rely on just testing, like the guy that checks pH, we rely on just those after testing. What we're trying to do is to see how much of a damage has been done. That is good in a way, but the essence of this meeting is to prevent the damage from happening. Because the idea with it is by the time we do the testing, we should have the result that we need. Now we're even just talking about a lot of discussion around water around here. It's even about what the water contains that it should not contain. Oftentimes, people are not even talking about what the water does not contain that it should contain. Because if you are using the RO system, for example, most times we find out that when the RO system works, it can take away from water everything in water, including the good, the bad, and the ugly. And when it doesn't work, it can even introduce into water what you didn't ask it to introduce. And so, if effort is not being made to the last man out to check whether the water contains what it shouldn't contain or does not contain what it should contain, you find out that a lot of the water that we drink in the market will fail test. We will not even go there for now, for today. But for suffice it to say that a lot of the contamination that we have are biological, chemical, and they can be also, physical hazards. Now, what water safety planning does is it helps us to shift the thinking and to shift our mindset from reactive testing to now a more proactive, preventive risk management. And what that means is that there has to be a deliberate effort at proper communication, deliberate effort at skill acquisition, deliberate effort at behavior change. And of course, the deliberate effort at ongoing monitoring and evaluation, ongoing vigilance of the whole entire supply chain. And this is key. And this is going to elevate, because that is where we're going to now move from the talking to the doing, to the actions. My friend will call it talking and do. We have to do talking and do. By as much as possible, helping water handlers get the right mindset. So that takes me to the next stage. Best practices for the water handlers. Who are water handlers? So every person that has to do anything to do with the chain that we have talked about, from the vendors, from the borehole operators, packaged water producers, from the tanker driver, the facility manager in that space, even the community committees that look after the water, even you that yourself that go to buy water for your family, you're a water handler. So every water handler has, by handling water, has become a major public health actor. And his decision is very important for the well-being of anybody and everybody who is going to rely on that water that he has come in contact with. And so this is important. And that is the reason we need to protect our sources from waste, must protect our sources from contamination, but protect them from sewage, from environmental contamination. That is the reason our builders, our real estate developers must understand this is what we're talking about, and how their activities and how their decisions and how their business calculations affect water quality and how it affects health and how it influences the environment where the estate that they're selling to these people. So simple preventive measures at source could prevent a lot of complex public. So when we are having this kind of meetings, we're supposed to have real estate developers sit here. We're supposed to have primary school teachers sit here. We're supposed to have local chiefs. We're supposed to have everybody listening to it and see how can you, within your own little space, break this chain of contamination and chain of transmission of water. Now, that takes us to the next slide. It talks about treatment, adequate treatment. How do you know when treatment is adequate? If you don't know the quality of the water from at the beginning, and you don't even have any way of knowing the quality of the water at the end. Sometimes I ask people about the quality, they say it's too expensive to test for water. So because it is too expensive, they just fetch it and they look at the cup, they say it looks good. I happen to be a member of my village primary health committee. I don't know what they call us, committee that look after the primary health. And we recently had a water a borehole dug in that project. So when we had our last meeting, I was asking the guy to send me the water quality result. He said they didn't analyze it. I said, but you reported that the water is good. He said, yeah, it's good. How do you know? He said they fetched the water and they left it overnight till the next day. And it didn't turn brown. So for him, this was happening last week. Proper test would have been if he turned brown, then he would know. And so you can understand that. Now filtration is good, but how do we even make sure that what we are doing? So it still goes back to guaranteeing that at source that the quality is good, so that anything else we do after that, be it filtration, chlorination, all those other treatments, can then deliver the proper quality water. Now, of course, clean equipment, personal hygiene, sanitary environment also will be important. How do we dispose what? And where do we dispose what? And how do we recycle water? And how do we treat water? So all of these things, and truly, it's a complex chain. It's a complex chain. And that's why before it gets complex, the most important thing is for us to be able to prevent the basic, simple things that we can do and communicate that and promote that, and then ensure that basic hygiene and sanitation can help us save a lot in that manner. Now, the transportation system, how about we have the tankers covered? How about we have those the interior of the tankers always clean, certified clean? How about we have some kind of preventive measures or some kind of committee or whatever it is called? I don't know. That make sure that these people are properly certified and maybe recertified on an ongoing basis. How about we even have some ways to trace and to document these things? When somebody gets water, for example, and finds out that that water, or drank that water and begin to have something, his stomach moves somehow. What do they do at that point? Or if they bought certain water and they realize that it is smelling or something, which is already as bad as it can get, what do they do at that point? And then what happens? Who follows up to make sure that even if they called, reported that somebody is doing the needful to prevent the rest of the people? So there is a need for us to think in systems about how we're going to scale this conversation beyond here to change behavior. Now, that takes me now to the next level, the household and community prevention. Household level prevention of water contamination. Now, when we have these containers, some of them, of course, designed to fit with their narrow neck, and of course, most of them are designed so that you can restrict hand contact with water, and we have these at home. But even at that, we can see that we can achieve some results by the design of the storage, of the water storage that we use. But there has to be more than just that. A lot of people now are beginning to. I was looking at some of the water purification that they make from ceramic pots. They design them to where people don't have to fetch water here or scoop from the pot. They use the taps, the regular, the normal taps, to fetch. That kind of reduces the chances of contamination. So the idea for household level prevention is that we must think a priori how to reduce exposure or contact to the water in such a way, because the less the contact, the less the physical contact, the less the exposure, then the less likely that water could be contaminated by the time people are drinking it. So for us, we understand that there is need for water for all uses to be of high quality. But How about even if we just guarantee the one that we drink and the one that we used to cook? If we begin from there, I'm sure it will go a long way. Some people think that once they boil their water, it is good. Some people think that once they filter their water, there's nothing you can tell them. Again, they don't, because they don't have any way of confirming, verifying evidence base at the end of the day that what they're taking is good, and then they work with their belief. And there's nothing you can tell them. There are some of the people that have been drinking water from their villages, and they can guarantee you that water is good, regardless of what is happening up here. And so we need to think about this is, at the community, how do we promote sanitation, promote water safety, and what measures can we domicile within those kind of communities to help in hygiene promotion, in surveillance, in strengthening their own local community resilience against outbreaks. These are very important positions. And then, of course, how can we partner with them? Because, like I said, the local chiefs, the community stewards, whatever they are called, how can we help to strengthen them and communicate to them in ways that we can help address? Because I was thinking that from this kind of conversation, what if we choose to map a few local governments where there are outrageous amount of waterborne diseases, tracked, and then begin to find out what is actually going on in those local communities, and how can we actually help them to address those things using, their own local infrastructure, looking their own system without creating any other bureaucracies. That would be something to take up from, beyond this conversation. Now, people will always adapt safer behaviors when they understand risk, when they understand the cost, or when they understand the opportunity cost. Every opportunity has cost. Whether you see it as a good opportunity now, no, there's a cost attached to it. Some people will borrow from tomorrow to pay for today, and then they are indebted tomorrow. So either way you look at it, if people have a good understanding, so if we invest in health promotion, if we invest in education, if we invest in proper communication, then we will save, on the other side. If we don't invest in those, then it will not come back to us as hospital bills, as lost time, time lost to productivity. And so leadership, it is leadership now to look at how to enforce policies and laws and the rules, and then of course where that vis-a-vis education and empowerment and community reorientation. And now it is important also for us to look at beyond the books, the cultural beliefs of the people, and how we can integrate that into communicating water safety and water safety concerns, and how that can help the people to not just change behavior, because again, we want to be respectful in our communication and we want them to change behavior, but we also want to have a sustained change. That change needs to be sustained over time. And that takes me to the role of regulation. Clear standards, very important. Licensing, like I already alluded to, very important. Inspections are very important. Enforcement is good because it can kind of help to create some kind of structured environment for safe water practices. And then, of course, regulation will always help to protect both the public and the operators. But have we even thought about standards, for example? Our national standard for drinking water quality is overdue for review and for upgrade. Licensing, for example, all this water players, I call them players within the water space, don't get licensed, don't pass any exam, don't get properly documented. And so even in inspections, I don't know how which ministries and at what point there are gaps in both inspection and enforcement. So these are the kind of conversations that we need to have beyond this kind of meeting to see how going forward can we sustain efforts and leverage the gains in what we already know, and then as we address emerging issues within the water safety space. Now, it is important for us to activate surveillance systems for early sign detection. It's also good for us to promote preventive practices to avoid all kinds of outbreaks, or even to stop them from escalating. And so it is good for us to have some kind of established monitoring procedures to be able to see how the risks within the water safety space are mitigated and controlled. And that takes me to communication again. Communication. Every time in our last meeting, communication came up very strongly. And today again, I think it's also coming up because our communication around the water safety space must be clear, must be consistent, must be action focused, and must be trust building. Because what happens is that when we keep silent, uncertainty is born. When we keep silent, when we message, but our messages are poor, then they can create doubt or they can create panic. And so there has to be some kind of way for us to really figure out how to communicate around water safety and water quality, and make our message very clear to where it doesn't create panic, but at the same time it leaves our people informed and aware of what to look out for, or what or what to do and what not to do. And maybe we should also, as much as possible, we need a lot more players within the water quality space in terms of advocacy, in terms of support, in terms of partnerships, because I haven't always been in the water quality space until I came to Nigeria in 2021, and I was forbidden from drinking bottled water that was supposed to have been a very expensive one, and so that actually was what now kind of brought us into that water quality advocacy space, and as part of the area of our interest, and we have actually seen that is a very viable area that a lot of people are overlooking. So I'm hoping that as we continue to engage, we should be able to attract some more partners within that space, even if it is as their corporate social responsibility to partner with the Ministry of Health to guarantee that access to clean water becomes one of those enshrined basic human rights. So as I'm trying to close, 5 key messages are important from this section. Number 1, water safety is a health security issue. It's a health security issue. Number 2, most of our waterborne diseases are preventable and they are avoidable. Now, water handlers are frontline public health workers. Every single one of them. Most of them don't know it, but it is our job to let them know. And then, of course, what that means is that it elevates our asking, it elevates our expectation, it elevates, what they can do, or what they cannot do within that space. Number 4, communities must be empowered. It's our job to empower communities. We can't blame people, who are using the only water they have, if we cannot, provide them what is good. So it will be our collective responsibility as a people, not just Ministry of Health, but everybody, to see how we can partner with communities within our own little space to elevate water safety. Now, number 5 point I want to leave here is that prevention is always more effective than response. Again, it's not a bad idea to respond when we have outbreaks or we have water quality issues or concerns. We have to respond to them. But then that should not be we should not wait to respond. That's what we're talking about policies. We're not going to wait until something goes wrong before we update our policy. We're not going to wait until somebody dies before. A few weeks ago, I think somebody died from a snake bite in the FCT. Everybody had been fumigating. Everywhere you go, they are fumigating. So we have to wait for somebody to die before we now start fumigating our houses. And so in this part of the world, we tend to be too reactive. And what this call calls on us today to do is to be more proactive, to be more system thinking, to be more preventive in what we do. Every safe glass of water represents disease prevented. Think about that. Every safe glass of water that you drink or give somebody is disease prevented. It's a hospital averted. It's a hospital bill prevented. It's a life protected. Every cup can be an under 5 mortality, avoided. Can be a perinatal issue, complication. It can be cancer prevented. It can be chronic kidney disease, avoided. So think about that, and then that will help you to understand how much of power you have within that space as somebody who could take a cup of water and give to somebody. Our work strengthens the foundation of national public health protection, and every single one of us who is a Nigerian has a responsibility to be a player and to partner with the ministry to see how we can do together, what we can do to guarantee water safety. And it is the pleasure and the honor of Rite Place to be part of this effort, and we don't take it for granted. So my final call to us: we need to protect the source, we need to protect the chain, and we need to protect the communities. It's by protecting the source and protecting the chain that we can guarantee healthy communities, and we can guarantee waterborne disease-free communities. I commend the Ministry of Health and Social Welfare and the water safety team for prioritizing water and for organizing this meeting. Together, through consistent leadership and through shared responsibility and through collaboration, we can ensure safe water for everyone within the Nigerian space. Once again, thank you for giving us the opportunity to share our thoughts with you and to partner with you in this journey. It's my pleasure. Thank you. Thank you. And thank you again.
Thank you, Dr. Chukwumezie Okolo, for that beautiful presentation. Good morning, esteemed permanent secretaries, directors, CEOs, and everyone on the call. I'm your co-moderator, Dr. Bosede. Over the past 30 minutes, we've listened to Dr. Chukwumezie Okolo telling us or talking to us on water safety, best practices, and preventive measures for water handlers and communities. And he has not just that, we all are players, we all are, everyone has a role to play in ensuring water safety in our environment. And he has also called on everyone to be an ambassador to ensure safety. And now we'll go over to question and answers. Please kindly use the Q&A button to drop your question. Our time is actually fast spent today. So we have a question here, sir.
Okay.
How can we prevent recontamination of large storage tanks?
Recontamination.
Yes, sir.
That means it's already contaminated.
Yes.
Okay. So how can we prevent recontamination? By the numerous practices. So number one, it depends on where this water is stored. And so if it is already contaminated, that means it is not, number one, it's no longer good for whatever use. And so the effort now, I'm not sure whether the effort now is about preventing recontamination or about how to get it to make it fit for purpose again. And so let me take it even up. So how do we prevent contamination of our good source? That's the area we have tried to cover. Now, so if we know what the source is and what all the possible sources of contamination, and then we stop, that is the way to go. So we have to properly map the possible sources of contamination, and then design and decide to stop those different possible sources of contamination. That's the way to stop contamination. And recontamination is the same thing, but then we don't even want it contaminated in the first place. We want to prevent contamination, and so we shouldn't be talking about recontamination. Somebody else could help me on that one. Recontamination. That's interesting.
Okay, so we have some comments also that has come in the area of strengthening legislation on water safety, because that aspect has been neglected for a long time. Then another comment is that until access to water is justiciable, issues of water safety will continue to receive little attention from government and water providers. As at now, what can citizens do when they are exposed to water contamination from miners and industrial effluents?
Yeah.
You get me, sir?
Yeah, I can hear you. Can you hear me?
Yes.
Yeah, I agree with those comments that and this is why it is incumbent on leadership. When I mean leadership, I mean all of us stakeholders within the water safety space to be proactive in ensuring water quality within the space. So if somebody is going to build a house, there should be questions around where is the source of water? How are we going to ensure that there is not going to be contamination? I mean, in this country, somebody will build a hospital, and then you go there, there's no water. How? You didn't think about water before you even dug the foundation of a hospital. So we need to start thinking in systems. We need to prioritize water. Because if we understand that a lot of our diseases are actually in the water, we all need water, then we should actually prioritize water in our decisions, in our before any endeavor, in our city planning, in our sewage disposal, in our maternity wards, in the communities, whatever it is. In some of the people that do constituency projects, they spend so much money on constituency projects, and then you get there, the water is next to sewage line. Although they have spent so much money and there is no filtration, it wasn't even tested to guarantee. It could be a hot spot for cholera right there, and people are clapping and celebrating. So we need to actually start ourselves to begin to ask questions, to begin to hold ourselves accountable. Until we hold ourselves accountable, there's so much we cannot do. Thank you.
Hey, Doctor, we are having quite more questions coming in now. That means the lecture was well understood. We'll try as much as possible to take more. Someone responded to the decontamination of storage tanks. It's for the question that was asked earlier. He said for large storage tanks, regular decontamination, using chlorine dosing to clean large storage tanks before rainy season.
Oh, yeah. Okay, so the problem also with that is, well, if you are going to talk about chlorination, that's another letter for another, because the people have to make sure that the chlorination is properly dosed. If they are not dosing chlorine properly, we could be having another issue, and most times they don't. Just like when you use the RO, for example, when you use RO, you're supposed to remineralize those water in most places. But of course, because our people, number one, it's expensive to remineralize. But two, we don't have the mathematical accuracy to be able to calculate those things. So we're not remineralizing. And that could be a challenge also. So I would just say, whatever measure that they could take to make sure that they clean their tanks. Just like the tanker driver that is supplying water, he has to clean his tank. So, but who is ensuring that he cleans his tank? How often should he be cleaning his tank? Have they even had any seminar or any workshop? Do they even have any form of licensing or certification that qualify them to even supply water in the first place? Where they are taught what to do and how to do. Some of these are things that we should also be thinking about. Thank you.
Sir, apologies to everyone, might not be able to take all the questions, but we'll harvest them and make it available to the resource person to provide answers to it. However, before we go, Doctor, I would like you to answer this question. Somebody asked, what is the general lifespan of our common water pipelines, and what could be done apart from replacement if it is discovered that water pipelines are contaminated?
Are there water engineers on the call? There's a water engineer on the call. Can you tell us the lifespan? Because I am not a water engineer, but I can tell us right away that it will depend on the material that they use for that piping. Now lately they're beginning to use more corrosive resistant kind of materials to pipe. But a lot of the places that had good water back in the day when we were growing up have not been changed in a long time. So I may not be able to answer you specifically about what should be the lifespan of the particular borehole or the particular piping that you have in your locality. But whatever be the case, they are beyond even the lifespan. The volume of water, the quality of the water from source going through that pipeline could drastically reduce whatever the lifespan is, and the nature of the chemicals that are also passing through that pipeline. So a lot of factors can actually determine how long. This has to be more like an intersectorial kind of operation, where all the relevant arms of government are working hand in hand to guarantee the quality of the water that is being supplied, especially in the metropolis. Thank you.
Sir, apologies once again. We won't be able to take all the questions, and we want to release you to go back to your various activities for the day. We want to thank you for joining us today on the 9th episode of this sector-wide webinar, and we encourage you to keep honoring our invitation. We also want to use this opportunity to appeal to all our agencies and parastatals that this platform is open for use for anyone to make a presentation or showcase what they are doing to the Nigerian people and to the entire health sector. Once again, we want to appreciate our Permanent Secretary for joining us in today's presentation, our directors, Permanent secretaries from other ministries, the head of service, and the host department today, Dr. Adeola Alufobi Yusuf, thank you so much for joining us and for being part of this webinar. And to our resource person, we are really grateful. A lot of questions came in. That shows that the topic was very important, well delivered, and well understood. Thank you so much, sir.
Thank you, ma'am.
I don't know if we have any comment from our panelists, the host department, Director of Food and Drug Service.
Thank you. Thank you once again. I only want to appreciate all our participants, starting from our permanent secretary and all other permanent secretaries from different ministries. And Dr. Okolo, I want to appreciate you for this well-delivered presentation. We have all learned that we need to take water safety from point of catchment down to the point of use. The quality must really be assured so that we ensure our good health. We ensure that the water we are taking is of good quality and it's safe for drinking and for use. Thank you, and we appreciate you and the company and the team for this wonderful presentation. And I want to thank our co-department, the planning, for making it today and having this presentation being done effectively. Thank you, and God bless.
Okay, on this note, to say thank you, everyone, and see you in the next episode.
What kind of devil is this? What? Everything failed. My internet failed. I exploded. My phone internet failed.